Hello, everyone, and thank you for joining us for the American Journal of Managed Care's Oncology Stakeholders Summit. This is the Spring 2016 Peer Exchange video program. This program, which focuses on value-based care in oncology, will include a roundtable discussion as well as a series of individual interviews featuring a distinguished group of healthcare experts with varied backgrounds in managed care, community oncology, and policy. My name is Dr. Drs Feinberg, and I am Vice President, Clinical Affairs and Chief Medical Officer at Cardinal Health Specialty Solutions. I am joined today by Dr. Alan Balch, Chief Executive Officer for National Patient Advocate Foundation in Hampton, Virginia, Mr. James Gilroy, Senior Director, Market Access and National Accounts at Lilly Oncology, Dr. Ira Klein, Senior Director of Healthcare Quality Strategy in the Strategic Customer Group of Janssen Pharmaceuticals, Dr. Michael Kolodziej, National Medical Director for Oncology Strategy at Aetna, and Mr. Ted Okon, Executive Director of Community Oncology Alliance. Thank you again for joining us. Guys, let's begin. Value-based care by definition incorporates cost into clinical decision-making. Robust debate continues as to what constitutes cost, who's responsible for managing cost, and how cost should be communicated. Today's discussion will illustrate the complexities inherent to assessing cost as our healthcare system migrates to value-based care. We'll be covering a few important topics: evolution of value-based care, what should be incorporated in value-based care, and how should value be calculated. So guys, let's start this off, and I think maybe I'm going to start with Ira, because Ira has sat on both sides of the fence now that he's working for a pharmaceutical company, lived for many years in a payer world. When you think about value, what's the definition that resonates with you?
Well, I would say, Bruce, that previously I had always said that value is the outcomes generated over the costs incurred. And over time, what I've come to realize is that the outcomes generated is actually not a single answer. It's value over a continuum. I should say outcomes over a continuum, because the outcomes differ depending on who you are. If you're the payer of services, you want to see that cost of a particular therapeutic be applied, and you also want to see the total cost of care be affected by that therapeutic. If you're a patient, you want to be sure that you're getting what you want for a disease. And a lot of this will focus on oncology, and so what do patients want? They want cure. If cure is not possible, they want amelioration of disease. And they always want to have minimal side effects, ease of use, and some kind of assurance that they'll be able to participate in, if not the same lifestyle as before, some kind of at least close to that previous lifestyle. So I've kind of evolved over time to thinking about outcomes as a continuum, sort of like 01, 02, 03.
All right, so I'm concerned from the patient perspective that although I think it's really important in terms of what Ira brought out, somebody who is living the world of the patient, I'm not sure that's the complete picture of what patients are looking for. And if they're really able to understand the process well enough that they can assess value in a meaningful way.
Yeah, I think first of all, it's important to keep in mind the system as it's currently constructed was not inherently designed for the patient to be an active consumer and decision maker in the process, and therefore value through that consumer and patient lens isn't really ingrained into the current framework. So I think this is an exciting opportunity from a patient perspective as we talk about shifting from volume to value, and as the increasing role of consumer-driven healthcare designs, as well as the shift in responsibility for payment shifts to patients, as well as the personalized medicine paradigms that are coming to fruition. There is an exciting opportunity for patients to be much more involved in this process of what is value. I think the rub is, from a patient perspective, what is value is, we think of that as at the individual level, and it really varies from person to person.